everyone, Assalamu alaikum. My name is Zaneb Mansha. I'm a mental health therapist, and this is Dr. Sheeba Rahman here. She's a board certified psychiatrist, and today we're going to be doing a mental health dialogue. So the way that it's set up today is, first we're going to start with Sheeba. She's going to walk us through a breathing exercise to help regulate us. And then after that, the way that we're going to do this is I'm going to have a list of questions that are commonly asked and are very important for our community. And so these are the questions I'm going to ask throughout, and Sheeba is going to give us some answers regarding them. And then at the end, after we answer these questions, we'll open the floor for you guys to also ask any questions that you might have as well. All right?
Thank you, Zaneb. So hopefully it'll be a nice interactive session because it's an intimate group. So we're going to start with a deep breathing exercise, and I do this often with my patients. So I'm going to ask everyone to take a deep breath. We're going to inhale through our nose and then slowly exhale through our mouth. And we're going to do that 3 times, and I'm going to guide you through it. Okay, ready? So inhale, exhale, inhale, exhale, and one more time. Inhale, and exhale. How do you feel? Good? Okay. So today we're going to try to put all our stress and our worries away, leave it at the door, relax and have a comforting, wholesome conversation with each other, hopefully, inshallah. I think when Zaneb and I talked about this, the idea is to just get everyone together in a positive way and have a positive outlook within the community with each other. So I'm going to hand this over to Zaneb so she can start her questions.
Thank you for that, Sheeba. So before we start, one of the questions I want to ask so that the audience can have a better understanding is, what is the purpose of the deep breathing exercise? What does that do for us?
So the reason we started with the deep breathing is to kind of physiologically get yourself to like a normal state of mind with your blood pressure, your vitals. Sometimes when people are in the midst of a panic attack, we ask people to do this deep breathing exercise. So physiologically, it's meant to calm you down. So it's a good tool to carry with you on a day-to-day basis. If something is happening and you find that your stress level is getting high, or you're feeling tense, or you're on edge, it's a good time to just pause and try this deep breathing exercise. And if you've noticed, it kind of helps you your muscles relax a little bit and your heart rate comes down a little bit. So it's just physiological technique to get yourself back to a healthier baseline. And I hope it helps. I hope you guys will use it. I actually do use it myself before every talk because it helps me relax. And then I notice everyone in the room as we sit that it helps them relax. So, and again, it's a nice technique to have, to use on a day-to-day basis.
That was a very detailed and great response, and like Sheeba said, as a therapist, I use this technique with my clients all the time as well. And so I just wanted everyone to get a better understanding of why we were starting with that. So now we'll start with the actual questions. So the first question that I have for you, Sheeba, is what are some things that affect our mental health?
It's a loaded question. It's a good question. Everything affects our mental health, as we all know. But as a psychiatrist, I go by the biopsychosocial model. There's doctors in the audience, so I think you guys might be familiar with that. So to start with, our genetics matter. Like, does your mom have depression? Does your sister have depression? Does your dad have depression? Do they have anxiety? So your genetic makeup does make a difference. And then, do you have any medical problems? Do you have thyroid problems? Do you have anemia? That can cause symptoms like fatigue or low mood. So whatever's happening biologically will affect our mood. It will affect our feelings. Are you taking any medications? There's a lot of medications where the side effects can either cause anxiety or low mood or fatigue. So there's a huge biological component to mental health. And sometimes in the community, there's a little bit of limited understanding of that, right? Sometimes you can't fight your genetics. Sometimes there are people whose families members there's a history and it can be genetically passed down. Then there's the psychological component. Is there any kind of trauma? Is there any kind of loss? Is there generational trauma in your family? So what is your upbringing like? What have you faced from your childhood until adulthood? So there are psychological factors. And then the third one, which is extremely important, are social factors, right? Who do we interact with on a day-to-day basis? Are you talking to people who are bringing you up and making you feel better? Or are you talking to people who are bringing you down and making you feel anxious? Finances matter. For me as a psychiatrist, when I ask people what's stressing you out, common things people say is their health. If you're in physical pain, that's going to cause a lot of stress. Finances, family, and interpersonal relationships. I mean, that's everything in a nutshell, right? Your work, your family, and money, and health. That's everything in a nutshell. It's very rare that it goes beyond that. And then again, in the biological component, I forgot to mention drugs and alcohol. Of course, if someone's using drugs and alcohol, that's going to affect their mental health. So what is your social setting? How are you interacting with your family members, with your friends? These are all things that come into play when we talk about mental health. And so as the talk goes on, I will give you tools on how to take care of your mental hygiene. The same way we have dental hygiene and physical health, we all have to take care of our mental health. And so all of these things matter and make up our mental health.
Thank you for that response, Sheeba. So it sounds like from what you're sharing that there are a lot of components that affect our mental health. And so as we go into the other questions, Sheeba will also share with us some tools and then some other issues that are common and might come up. So the next question I have for you is regarding what your role is as a psychiatrist in mental health and what the other roles are. So we have a psychiatrist, we have a psychologist, and then we have a therapist. And so as I mentioned earlier, I am a mental health therapist and Sheeba is a psychiatrist. So can you tell us a little bit about what's the difference between each of those?
It's a very important question. A lot of times people say, oh, you're a psychologist or a therapist, and I'm sure you get that a lot too. So there's a lot of similarities between what we do, but there's a lot of differences as well. So I'm a medical doctor. I went to medical school. I did my residency, and then my residency was specializing in the mind. So there's the brain and the mind. So psychiatrists take a very medical approach to things, and we basically treat symptoms. We treat the symptoms that we evaluate, and when a patient comes to us, we go deep into the mind and explore their current and past traumas. We explore their medical issues. We explore their allergies. Like, we get a whole picture of their mind in one assessment. And so we go quite deep. And then we sometimes, once we evaluate, come up with an assessment, a diagnosis, and a plan, we will send patients to a therapist and we'll say, okay, I may start you on this medication, but in addition to that, you need therapy as well. And so it's kind of like if someone injures their shoulder, they'll go see a doctor, the doctor will treat the shoulder, and then they'll say, okay, we gave you an injection or we gave you medications, but now you have to go to physical therapy. And physical therapy is a really important part of your treatment. So it's very similar with mental health. People will come see me, and then later on I refer them to a therapist, and vice versa. Sometimes they'll see the therapist first, and the therapist will say, well, maybe you need something more, maybe you need some medications, and then they'll send the patients over to us. A lot of times I'm able to guide my patients. I really don't want your therapies to be a venting session. I want you to have tools on how to cope with certain circumstances. And if you're not talking about that, then you may want to reconsider the therapist. So having cultural sensitivity in therapy is very important, which is why it's really important that Zaneb comes and shares these conversations with everyone, because we come from a unique culture and unique position. So it's really important when you go speak to your therapist that they're sensitive towards who you are and what your background is. And then a psychologist, sometimes, particularly with ADHD and autism, sometimes I send people for formal psychological testing. And then when they develop a report, I interpret that report and then start the treatment accordingly. So they will work with the behaviors, whereas I will work with the symptoms, and I will treat and manage the symptoms, and then the behaviors come up over time. So long term, I ask them to follow up with therapy in addition. It's a long answer, but I hope it makes sense.
Thank you, Sheeba. That was a very detailed response, and something that stood out to me from what you were saying was that you said as a psychiatrist you are focused on treating the symptoms, and then as a therapist I focus on the behavior. So a question that a lot of people come to me and they have about that as well is, how often do you see each professional? So I know the answer, but can you share with the audience what the answer is, typically how often you would see each person?
So for medication management, once I initiate medications for people, I ask them to come back in 2 to 4 weeks, just so I can see how they're doing. And most of the medications I prescribe, they take 4 to 6 weeks to see how it's working. And once people are stable, once every 3 months, once every 6 months. And then for therapy, really it depends on each individual. Sometimes people need weekly therapy, sometimes people need monthly therapy. So it depends on where they are in their life. Therapy should not just be discussing your problems and venting and talking bad about your family and you hate everyone and the therapist agrees. Like, it's never that. It's really about, how do I cope with this? How do I cope with this situation when I see everybody doing this on social media and I'm not? Now I'm feeling alienated and I'm feeling isolated. How do I cope with this? So the therapy part, I always want to see that people are engaging in some kind of techniques to reframe and restructure their thoughts. And again, it can be as frequently as you want and the patient wants. But medication-wise, it depends on the patient, but typically once a month or once every 3 months.
Yes, and I like how you mentioned that with therapy, it usually is more frequently because you're building tools and coping skills, and you're not just venting and complaining every time. And part of the session is going to be you sharing what you're feeling, but with a good therapist, you should also be working on skills and ways to help you manage how you're feeling. So with therapy, usually with clients, I start with them weekly, depending on what their issues are. And then same thing as with a psychiatry appointment, where as you progress, then you start to have less frequent appointments as well. So that's a big distinction between the two professions, and a lot of clients come to both of us with those questions, and they're usually, from what I've seen, a significant amount of my clients need more than just therapy, and they'll also need medication as well, and vice versa. So it's important for people to have an understanding of what the role of each professional is, so that they know, who am I telling what issue to, and what support am I getting from each professional. Okay, so then the next question that I have is also regarding the medication. So what are some of the stigmas associated with taking medication for your mental health that exist in our community?
So has anybody ever taken medications for your mental health? Okay. Thank you for your honesty. That's amazing. That's the thing, when people hear medications for mental health, they get really nervous about talking about it or thinking about it. And it's almost, it's taboo, like, oh my God, this person's on Lexapro, or this person's on Zoloft, or this person's on Prozac. The reality is, you have to do what you have to do to take care of your mental health. Sometimes people have difficulties with sleep, and they try everything in the book, and maybe they need something to help them sleep. Sometimes people can have a very healthy lifestyle, but they're still feeling down and depressed, and they need what they need. So the medications that I prescribe obviously are psychotropic medications. We work with the chemicals in the brain that help you feel good, like serotonin and dopamine. And one thing that I want to clarify to everybody, that these are not addictive medications. They're not. It's not like once you start it, you can never come off of it. You may take it for a month and be fine, and then get tapered off of it. You may take it for 6 months and be fine. So they're not like dangerous, and people will be like, oh my God, if you're gonna take this, you're never gonna stop taking it, or it's gonna, with any medication, there's always risks and benefits involved, but you have to see where you're at in life. And sometimes everyone has the right to feel depressed, right? But if you're feeling depressed all day, every day, and now it's been weeks, you may want to consider something that'll help you feel better. Same thing with anxiety. All of us can feel anxious throughout the day, but if we're feeling anxious every day, all day, and it's been weeks, then it might be not a bad idea to consider medications. So thyroid disease, high blood pressure, it has nothing to do with what we're doing on a normal day. It just happens, and we have to take medications when we have to take medications. So I think for us and our community, we have to start looking our mind and body and our soul as one together unit, you know? And so it's the same way you would be forced to take something for your blood pressure if it was high, you would want to take something for your mental health if you needed to. So again, everyone's allowed to have a good day and a bad day, but if you're feeling low on, days and days and on end, and it's been weeks, then it might be a good idea to consider medications. And again, there's a risk-benefit ratio, which we discuss with everybody. There's always risks involved. There's more benefits than risks, obviously. That's when we prescribe the medications. And again, the combination of the two is always the best.
Absolutely. And with that, so there are some people who are completely against medication, right? And me as a therapist, I often refer my clients to a psychiatrist, and it can take time for them to even, be willing to consider it. And a lot of times they have those same worries that you were bringing up, and they get worried about it being addictive, or they get worried what other people might think. And so I see that a lot with my clients, and I have to work on that a lot with them and figure out where that's coming from. And then also, in the meantime, I work on tools with them. And so it doesn't mean that you won't get benefit without the medication. Obviously, the medication in a lot of cases will give you the extra boost that you need. So what would you recommend for people who, let's say, are just like, I don't want to take medication at all? Are there other therapeutic tools that you recommend for them in that case?
Yes, absolutely. Because there are people who just feel that way, and you can't force them to, and they have the autonomy to decide. Number one treatment for anxiety and depression, the reason I keep saying anxiety and depression because it's so common. Those are the most common disorders that I treat, right? Versus bipolar, schizophrenia, they're not as common. And then depression, anxiety, more common in females, of course. So what do I recommend outside of medication and therapy? Exercise. Exercise is the number one treatment for depression and anxiety without medications and without therapy. And the reason is because you physically are forcing the release of endorphins. And so you start to feel better if you do it consistently. So repetition matters as well. So I tell people you don't have to do anything fancy, you don't have to do anything expensive, just go for a walk, go for a 20-minute walk, and just relax. And give yourself your time for your mental health, and exercise is the best. And it's counterintuitive when you're depressed, because people will be like, doctor, I can't even get out of bed. You want me to exercise? And I'm like, yes, because it's part of your treatment. So you have to kind of force yourself to get up and get moving. So meditation is a common practice that people do. And in our community, of course, prayers, right? We pray every day, 5 times a day, and it's repetition. So a lot of times in our community, we make prayer a task, but I try to encourage people to see prayer as this is my moment of peace. This is my moment where after I'm done praying, I will talk to the Almighty and release my stress and let it go. So we use a lot of positive terminology in our prayers. We're always saying praises and worshiping God. So these things are kind of built-in exercises to elevate us. Like we have a great God that we worship. We have, the ability to stop in the midst of our stressful day and just pause and communicate with Him. So I always encourage people to use that also as your therapy. So this is kind of like a parallel to meditation for us, So it's instead of like, oh, I gotta rush, I gotta pray, it's like, oh, I'm gonna pray. This is my 5 minutes of peace to myself, So prayer is always good. Journaling, does anybody journal? Yeah, me too. Especially when I'm trying to lose weight, I write down my weight and then try to, it's good because then you can go back and think, okay, I was, this is what I was doing this day and now I've come so far. So you think it and you write it and then you leave it in that book, until your sister finds it and leaves it to other people. No, I'm just kidding. Hopefully that never happens. But yeah, these are tools and techniques that you can do on a daily basis. But sometimes, Zaneb, you and I know this, you can do all those things and someone says something mean to you and you're stopped. And you're like, wait, I meditated and this just ruined my day. Like, what can I do, you know? And so that's the thing, you have to understand that feelings will change throughout the day, but they're just feelings, right? So it's like when it rains, we take our umbrella out, we put our hoodie on, but we don't need that hoodie every day, and we don't need that umbrella every day. We just leave it for yesterday and we move on, right? So that's how feelings are. You gotta let things go. And so make that your mantra when the negativity comes and when you're doing all your self-care and that mean person says, you know, whatever's mean, and then you just let it go. That's them, that's not me, you know? So again, mantras, tools, these things help a lot.
And I love what you said about the analogy near the end, because I tell my clients, a lot of times I tell them, you can't always trust your feelings. And, you know, we feel what we're feeling so strongly in that moment, and we can't always trust that that's actually reality, like what we're feeling in that moment. So we react out of what we're feeling, and then a lot of times we end up regretting it after. So that's also where the deep breathing that we talked about earlier can come in handy. You know, taking a deep breath, regulating ourselves, calming ourselves down, even walking away for a little bit, and yeah, that's a very helpful tool, and I teach it to my clients that are little kids as well too. And I think it's so important for us to, you know, be able to learn these things and be able to model them for the future generations as well. So thank you for sharing your answer regarding that. And then the next question I have for you, and we talked a little bit about this already, but what would you say are the most common mental health issues today? And then which ones would you say you're seeing mostly in our community?
Yeah, again, loaded question. We're seeing a lot of mental health issues on the rise. That's why most of you know my schedule is crazy busy, and it takes me a long time to text people back because I'm in the middle of a lot of things. There's a lot going on with mental health these days. We have a lot more triggers than we used to have. So I didn't grow up with a cell phone. I didn't have social media to look at and compare myself to constantly. Whereas now I fear for the youth because they have something where they're constantly comparing themselves to other people. So it's almost like what a common trend I'm noticing is that you can have a perfectly good day and a perfectly good evening until you see that picture of someone else who had an even better evening in your mind, right? In your mind. So it all of a sudden minimizes the fun that you had, and now you're putting yourself in that person's shoes. So studies are being done on all these different outlets, and even though there's a lot of good in it, right? Like we all feel connected through social media. We all feel a little bit more personal with each other through social media. You know, you and I were doing this talk, we put it out on social media. There's so many advantages, but you really have to be able to monitor how much it's affecting you, how much time you're giving yourself with social media. It is causing anxiety, it is causing low self-esteem. We may not think it is. We may not think it is. You may put it away in the second and think it didn't bother you until a couple of days later. And I just read someone had written like, oh, I was looking at social media and I didn't feel thin enough, and I didn't feel this enough, and I didn't feel that enough, and you know, I wasted my life getting educated. You know what I mean? Like there's all these messages that we're getting and we're inundated. And back in the day, there used to be a time for that. The 11 o'clock news, you know, 9 p.m. this, you know, there used to be timings for shows and when we're getting this information. Now it's constant, okay? It's interfering with people's sleep, right? Like sometimes you go to bed and you're like, okay, let me just check this. You can't fall asleep and then you have your phone to rely on. So I tell my patients, put the phone away. Put it away at night, you know? But then my friends will get messages from me at like 2 a.m., you know? So I also have to practice that. In our community in general, because there's such a lack of understanding of mental health, I feel that we need to be more gentle with each other, right? And we need to bring each other up and surround ourselves with positive company. And I'm really thankful and blessed, such amazing people here today. My friends are all really positive people, really self-aware, and always willing to bring you up with them. So what happens sometimes is when people are feeling bad, like they'll make the other person come down to their level. But if you're feeling good, you'll pull someone up to come up to your level. So you have to be very self-aware. Like sometimes If I'm hungry, maybe I'll say, Zaneb, are you hungry? You wanna get something to eat? Are you sure you're not hungry? But it's actually I'm the one who's hungry. So I'm saying it to you, right? Like I went out the other day and my friend's kids were there and I kept saying, you sure they don't want fries? And I wanted fries, so I kept insisting that they have fries. And then my husband's like, why don't you just get your fries? And I'm like, yeah, you're right, I should. But we project onto each other constantly. So pick and choose wisely who your company is. And thank God, alhamdulillah, we're blessed. Everybody's here on a Saturday afternoon. We were getting a little anxious, is anyone gonna come? But thank God, we all wanna take care of ourselves and then with each other. And we wanna build bridges. We're not walking around with a scissor and cutting people out. But there are people like that. And we have to be cognizant of that and just let it go, step away, and you do you. So again, there are ways to kind of manage these things, and we want to perpetuate healthy behaviors. So feelings will go away, mood will go away, but your behavior can affect you and other people. So I always tell my patients, if you're in a moment where you can't control yourself, step away from the situation and go do your deep breathing. Just step away. Yeah. Don't get all escalated in the mood and try to de-escalate, and step away if you can't manage in that moment. So I hope that helps.
And something I want to add is I have a friend who she recently told me, she said that whenever she gets angry or she feels a strong emotion, she goes and she does wudu. And she says the water helps calm her down. And then after she's like, okay, now I'm good. And it makes sense if you're using cold water, right? Because it's similar to one of the techniques I teach my clients. And it's a DBT technique, and it's holding ice or chewing ice. And so pretty much what you're doing, it's like a cold shower. If anyone's done like a cold shower or a cold plunge before, pretty much you're shocking your nervous system and you're slowing yourself down, and it's because you're forced to take a deep breath because you're so cold. And so with that, I thought it was very interesting how she tied, Islam and faith into that. And she's like, well, I just do wudu, and then I always feel better after. And I hear someone in the audience also agreeing with that as well. So, and my dad used to always tell me growing up, he said it was sunnah to drink cold water when you're angry. I don't know how true that is, but he would always, it is, yeah, he would always tell me that. And I remember I would get more angry because I'd be like, you're pointing out the fact that I'm angry. But now I'm older and I'm like, it makes sense. It makes sense now. But thank you for sharing that. And that leads us into the next question. So I know we talked a lot about how the community has an impact on our mental health and how we treat each other, how we talk to each other, how we act with each other. And so can you share how we can work together as a community to prevent mental health problems?
Yeah, absolutely. So I like what you brought up about the drinking of the water, because it really is therapeutic. And I actually just got a water app to remind me to drink water. And Sabina, you drink a lot of water, and I admire that. So I'm always like, okay, I have to remind myself to drink water because it is therapeutic. And in fact, I was in Medina and I saw some lady having a panic attack. And so at that moment, my mother and I were sitting there, and I'm like, should I intervene? And she's like, yeah, you should, because you're probably the only psychiatrist here. So I had to kind of help and, explain to them that I'm a doctor, which thankfully they all understood. And I said, we need water, which they all understood. And so immediately that was like a mechanism to calm somebody down. So that was a really good point that you made. And I want to kind of reestablish the point that it's, use the water, it's, our natural resource. As far as what we can do for each other, when we as Muslims greet each other, we say salam to each other, and that again is a universal term that we have. Just like water is a universal drink for all of us, doctor is a universal term anywhere you would know. But Muslim people, we say salam to each other in any Muslim country, they know what you're saying, right? So salam is we're giving peace to each other. Once you say salam and you deliver that, maintain the integrity of that greeting. Keep the conversation peaceful. Keep it where you started. Keep the peace in that conversation. And what happens sometimes is people will greet you with salam, but then what comes after is not as peaceful. And like I said, it's all about human behaviors and interactions, how we're receiving messages from each other, how we're giving messages to each other. When we all go pray in congregation, that's to bring us together and give us cohesiveness. And when at the sound of Allahu Akbar, we all have our head on the ground, it's because now we're just worshiping in humility, right? Nobody knows who's a doctor, who's a lawyer, who's this, who's that. We're all worshiping in humility. We're all the same in front of God, you know? So we need to apply these principles in our behaviors because it's built into the deen. And so our built-in system is so remarkable and it's so amazing, but we need to bring it to our attention that, okay, this is therapeutic for me. The wudu is therapeutic. Standing together in congregation is therapeutic. Even after Jummah, after the khutbah, people should feel enlightened. That should be the best part of the week. You know, I always ask my husband, how was Jummah? What did you learn? How was it? Was it a good experience or not? Because it should always be. These are prophetic, these are prophetic principles, and greet each other with a smile. I mean, these are all prophetic principles that we learn from the Sunnah of the Prophet, peace be upon him. And I'm not a religious scholar or anything, but as a Muslim, when I'm telling people these things, I'm like, wait, in Islam, we have these things built into our system, thankfully. And a lot of times, as part of my assessment, I have to ask people, do you practice any particular religion? And there's a reason for that. It's because religion and having faith is protective for your mind. It protects you. It gives you a community to go to. Do you go to church and pray? Yes, I go. I do this at the church. I do this at the synagogue. It makes people feel better to be in a community where you feel welcomed. So it's really important to create that environment here where we all feel welcomed and we all feel together. Thankfully, there's activities during Ramadan that we're all planning because we're all going to come together. And so that's all therapeutic and healing to do things together. This way no one feels alienated or isolated or left out. And unfortunately, there's been a culture of bullying, right, within the system, right? Your hair is showing, or this is showing, or that's not right. So we don't want to be like the police and the masjid. We just want to be inviting and welcoming to each other. We have no right to judge people, right? And even as a psychiatrist, I can't tell people you're anxious, you're depressed. I don't have the right to do that unless you're my patient. We're having that confidential conversation, So, but at least as a community member, we should all take care of each other and try to take care of each other's mental health and be sensitive to each other's needs. And I think thankfully, alhamdulillah, this community just being present here says a lot,
Absolutely, and I love how at the end you mentioned the thing about confidentiality, so I just wanted to see if you could elaborate a little bit on that, because a lot of people don't know what that means in terms of our careers and what we do, so if you don't mind sharing a little bit.
Yeah, so mental health is a very private matter, and it's a serious matter. I obviously take it very seriously, so once we establish a doctor-patient relationship, that remains between that doctor and that patient. It does not go outside. There is a contract of trust there, and so sometimes what people don't understand, they'll be like, oh, what happened to my this and what happened to my that? They're not going to hear it from us, because now we're in a binding contract that person trusts us and we will keep that confidential. And it's not a personal conversation, it's a professional conversation, and our job is really to help people. We take an oath to do no harm, and we can, and so, sometimes I think we both get this where people will be like, do I have this, do I have that? And that's common, my husband gets that too. That happens in all fields of medicine, I'm sure, where people will say, oh, how's my skin, what should I do, right? Or how do I treat my kids' allergies, right? Like, we all get that, and we want to support the community and be there for them. But once you establish that doctor-patient relationship, just trust that it has to be confidential. It's a private matter, it's a personal matter. And again, we're here to help. We're here to say, like, there are Muslim women here available to help you. We do understand the culture, we do understand the deen, and we do understand mental health. We've studied it for years and years and years, thank God, alhamdulillah. And so we want to make sure that everybody knows that we're here as a resource to help you all.
Thank you so much for sharing that, and I agree with what she shared as well. A lot of times in our fields we have people coming to us, friends or family members, and they're like, well, what would you diagnose me with? And like Sheeba said, that's not something that we are supposed to be doing, right? If you're our client and it's an established relationship, then obviously that would be our job to find a diagnosis and help you with the treatment. And in that way, it would be confidential. By law, we would not be allowed to, tell anyone else other than, the treatment team what is going on or what you're sharing with us. So it would be confidential. But there are a lot of instances I've had, and I know Sheeba has had as well, where people will come up to us and they'll be like, well, can't you just diagnose me? Can't you just do this? And we can't. So just to answer that question for anyone that's wondering, but like she said, there are the resources available. So if we're not able to see you as a client, we have so many people as well who we can, refer family and friends to. So we want people to be aware of that and know that the resources are available. Okay, so with that being said, I know we also talked a little bit about, so my recent question was regarding the community, and I know you brought up bullying, and that's something that we've noticed quite a bit in the community. And there's been a lot of judgment, and not just here, but in general, we've noticed that that's one of the big things that a lot of my Muslim clients come in with, is a lot of judgment from people, whether it's family, friends, strangers, whoever it is. There's a lot of judgment going on, and a lot of it is actually pushing them away from the religion, and it's pushing them away from the faith. And so some of the things that I've noticed is, like Sheeba had mentioned, nitpicking at how someone is presenting. For example, if someone's coming to pray and someone comes up to them and is telling them, oh, like a little piece of your hair is showing, like your prayer is not going to count. That's considered bullying, right? Because in that sense, you are pushing someone away, you're telling them, you're playing judge in that situation. And there's a right way. If you were to, try to guide someone, there's a different way to do that rather than in that situation. And I know a story that was shared with me where that happened to someone and they never came back to the mosque after that. And then there was another recent situation that happened, and this happened to me, and someone told me that they didn't like that I had my nails done and that I shouldn't post anything online with my nails done because people would think that I'm not a Muslim. And they would not want to talk to me, they would not want to eat anything out of my hands, they would not want to listen to me. And I was able to laugh it off. This was very recent that this happened. I was able to laugh it off, but I think that's because I've done a lot of work and I'm a therapist, so I can kind of understand for me that that's someone projecting either onto me or they're, saying something that just, like, to me, that doesn't resonate and I don't agree with that. And so I think that's just a very important topic, and those are just a few examples. Sheeba, do you have any examples like that you want to share?
Yes, plenty. I really do. I've been bullied in the masjid many times. I think once I went for Eid namaz, Eid prayer, and someone manhandled me and moved me to the side and stand in line. Or I was giving a lecture once and some lady said, well, we couldn't pay attention to you because your hair was showing, so we didn't get a word of what you said. And I'm like, well, I'm sorry, sorry to hear that, But that is bullying. That is bullying, and ultimately we are humans and we're here to help, and this is what we're doing is community service because that's what we believe in. And this stems back not just from today, but from years and years of training, when you're a medical student, you want to save the world. We start long before, and so thankfully those comments didn't really stop us from doing those things because there's that one or two people who get something good out of this. And so I would hate for someone else to suffer because of one person's, actions. So thankfully, between yourself and myself, we have the maturity to look beyond that. But there's people who are younger who really literally stop. I was once at the masjid and I saw this young lady, very nicely dressed, fully covered, stands for Jummah, and the lady from behind the masjid comes and brings her a skirt and this and that to cover her. And we both looked at each other and she looked at me like, do I look okay? And I was like, yeah, you look fine. But she still put everything on, but guess what? I never saw her again. I never ever saw her again. And I would just hate to be the person that because of me, someone feels afraid to go to the mosque. I mean, the mosque is where we go and worship the Almighty. It's a peaceful place. I know there's rules. I know there's all that, but let's look at the big picture. To be, young and in your 20s and coming to the mosque on a Saturday, it's noble work. Let's just encourage that and let's not nitpick on each other or bully each other out of doing something good. So I think that's another thing, like we have to kind of stand back and look up from the mountain. Like, what is the impact this is gonna have? And is it the hair showing and that strand that's gonna make this person's life better or worse? Or me saying that don't ever come to the masjid like this ever again? That's scary, that's threatening, it's bullying in its own way. So I'm not saying don't follow rules. Everybody should follow rules, and though I respect those rules. But what I'm saying, look at the big picture. What impact is that gonna have on that person? And nowadays, religion is, we're lucky to have faith. We're lucky to have a community. Slowly but surely, those ideas are phasing out in general. I'm not talking about our religion or any particular religion, but just the idea of that is starting to fizzle out because there's so much other information. People are finding comfort in all kinds of other things and avenues. So we want to preserve our community. We want to make sure that we bond together. So I'm sorry you had to go through that experience. I know she had shared that experience with me, and I had empathized with her because I've gone through it as well. I'm sure plenty of other people have as well. But again, like, we have to be resilient and just kind of keep showing up to, we both know that our intention is good. And I'm sure the people who are critiquing, perhaps their intention is good too. But again, they have to look at that picture. Like, if I'm gonna criticize someone, it might ruin their day, and I don't wanna be that person. I don't wanna be the person that because of my comment, someone stopped coming to the masjid altogether. So again, try to be inclusive, inviting, empathetic. Like, these are things that we all need to embrace. And then the little things, try to let it go, and let's let God do the judging, That's not for us to decide who's better or worse.
Absolutely, and I completely agree with everything you said. And like you said, also for us, we're in the field, and so it might be a little bit easier for us now to be able to work through those things, but it's not always easy for people who don't have the tools for something like that. And for us, we didn't have the tools overnight either. It's because we studied this.
Yeah.
And so, so I think the most important thing for us to do in terms of that, like Sheeba shared, is that we have to be very mindful of how we interact with each other and how we speak to each other. And that is definitely one of the most important things that we can do as a community to support each other's mental health. So that's all the questions that I have for you today, Sheeba. So thank you, Dr. Sheeba, for your time and your insights on this very important topic. And now we're just going to allow time for anyone to ask any questions that they might have about anything that we shared, or any comments.
The idea that I have about therapists, to be honest, that they don't make things better for the person.
Okay.
For example, like if a person is depressed, he goes. I'm talking about the therapist in my country. If the person feels depressed, he goes to see a therapist. Then the therapist starts asking him questions stage by stage. For example, this week they talked about when they were 10 years old.
Right.
And the other week when they were 5 years old. And like that. Like you said, they collect information to know what's the problem.
Right.
But this therapist has no idea that this person is depressing everyone around him.
Yeah.
Because he's remembering things.
Right.
Okay, he's doing nothing to the therapist, but he's being angry and giving negative energy
Yeah.
to people around this community.
That's a very good question.
So why they do that?
So basically what she's
they
saying.
tell them you have this problem, and then they just leave them.
Yeah, so that's the thing. When you and I were talking about this, there's side effects to therapy too, right? When you dig deep and talk about the trauma in that moment, you can feel a certain way. Now, I always talk to my patients about, I know that during this evaluation, you may have your composure, but when you go outside, it's just like your family kind of knows who you really are. And then the family members will be like, well, what is your therapist teaching you because you're being so mean to everybody, right? Like, there's side effects to those things, right? So what I'm gonna say is that your behavior matters, right? So just because you're feeling a certain way, it does not mean that you can lash out on everybody else. And that is the purpose, like in therapy, is that the therapist should work with you on your behavior. Like, look, you will and you may feel this way now that we've talked about this, but that's not an excuse for you to lash out on everybody else. So the purpose of therapy is not to hold on to bad memories and to hold on to trauma. It's really to restructure and reframe the thoughts that lead you to behave in a certain way that's disrupting your daily functioning, right? So if someone's had a trauma and they're fearful of certain types of people and they react a certain way, the therapist should go back in time and help them reframe and restructure those thoughts so that that behavior changes. So it's a lot deeper, but on the surface, sometimes people lash out. And so, like I said, there's side effects to therapy
But
as well.
you can't blame them.
No, there's no blame. Like, it's not blame, it's more like this happened to you, it's not your fault. It's really not somebody's fault if they've had a trauma, right? Like, for example, if somebody was abused physically, and then they're nervous to be around their mother or their father because that was the perpetrator, and they're gonna have some anxiety, it's not their fault, you know? But that's why they're trying to heal. So therapy is supposed to be the healing process, right? And it's hard to actually explain it to family members and everyone else while the person is going through it. And again, that's where I think all this sensitivity and family issues matters. For example, I get Muslim patients that will say, my therapist told me to move out of my house. They told me never to talk to my mom. They told me never to talk to my dad. You know what I mean? And so we want to be sensitive that we come from like a family, like where a family is very, very important. And so that's not a treatment. That's not a treatment. Stop talking to your mom, stop talking to your dad, move out of your house. That's not a treatment. The treatment is how do we deal with all of these things. So it's a little bit deeper, whereas the behavior may be something. And again, it's not an excuse for people, but there are reasons sometimes where people behave a certain way. But it's a very good question because a lot of times people will say, well, why can you talk to our family member? Or they'll say, my husband noticed I'm doing better, or my sister noticed I'm doing better, or my mother noticed I'm doing better. That's when I'm like, I like your therapist. I like the way this is going. You know, I think whatever coping skills you're using is good. So the idea is to work on your interpersonal relationships and to work on your, and not just to hold on to your trauma. The other thing is, therapy is not supposed to be depressing. It's not. It's supposed to be healing, you know? And what we encourage is for people to have fun things to do. And I think recently, about a year ago, I started doing activities with the community where it's not like a lecture, it's not a talk, we just do something fun. We make chocolate, we go, you know, listen to music, or we do something fun, productive, creative. So we're using the part of our brain that's gonna make us feel better. So a lot of times we delegate these things like, you know what, instead of sitting at home and do something creative. That's also good for your mind. So again, I think the perception in a lot of different places, you're gonna go to your therapist is gonna tell you, don't talk to mom, dad, you know, they're gonna tell you to hate everybody. Don't do that, you know? So be aware, have that awareness that I'm going to therapy to heal, not to make matters worse for myself or my family, you know?
Yeah, but what's the solution? For example, someone had a trauma when he was 10, for example.
Right.
And then he just told the therapist that I have this trauma. Then he's gonna leave the therapist for a week. Okay? Until he sees him for the other week, how he will...
Between the time, so first of all, it's a process, right? Like, so God forbid something really bad happens, it takes time to heal. For example, I burnt myself like 5 years ago. I have a scar on my arm. It's still there. It doesn't hurt anymore, but it's still there. So it takes time to heal from deep wounds, right? However, you should ask your therapist between now and then, what should I do so that I don't lash out on everybody else? Can you give me tools on how to deal with those feelings? And just for that 1 week, you work on it. And it's a work, it takes time. Like I said, prayers 5 times. Even in our prayers, repetition. All of this is repetition. Workout every day, every other day. Diet, I stopped dieting for a week and I look different 2 weeks later. You know what I mean? Like, you have to stay consistent with your treatment. So you have to understand that the person is healing, and you have to give them time to heal. And the person also has to understand that it's going to take time to heal, and work with your therapist. Like, look, I don't want to be inflammatory to my family. I need a week of how do I cope with this and how do I deal with this. And sometimes the family can give triggers. That doesn't mean you cut them out. It just you work with how do I deal with those triggers. How do I look at myself in the mirror and say, okay, I'm not going to react to this, and that. That's when journaling and praying, those silent forms of venting really works, So I do encourage that. And does it go away? Of course it does. It can, but it takes time. And everybody has their own process. Like when there comes to grief, bereavement, everybody's different. Some people it takes weeks, some people it takes months, some people it takes years. But you have to tell yourself at one point, I'm gonna start healing now. This is my healing. Therapy is healing for that person. And so they have to tell themselves, this is not my excuse to go home and lash out on people. It's like me beginning to heal from whatever the trauma was. Zaneb, I think you might be able to elaborate on this as well.
So, I think that's a great question that you asked. And one thing that I would say is, depending on what the age is, you said the trauma happened when it was 10. Is this person, like, when you're asking the question, are they an adult now, or are they still?
No, adult.
They're an adult now, okay. So I work with kids and adults, so that's why I was asking what I should give the answer based on. So if they're an adult, either ways, what we would wanna make sure is that that person has a support system, right? And so if they're going to talk about a trauma that happened when they were 10 and now they're an adult, that's something that happened so long ago, and now they're bringing it up again, and they're gonna feel those feelings and emotions likely from when it happened, right? And so that's going to be very intense a lot of times for that client, and so it's so important that before they leave that session that you do talk to them as a therapist. You discuss with them ways that they can manage if they get triggered, if something happens, who they'll reach out to, and usually the therapist should be one of the people that they reach out to in that case. But they should also discuss like family members or friends or other people that they can talk to, and they can remind them what coping skills and tools to use. And for me, when I work with my clients, especially with the minors, I always work with the parents and family as well, because if I'm teaching the kids a tool, they're not always willing to use it on their own, or when they're triggered, they're not willing to use it. And it's the same thing with adults. They're not always wanting to use it in that moment. So it's good to have a reminder so that that client, whether they're an adult or a child, if they have someone who is a good support system for them, they should share with that person, whether it's like your best friend or your mom. You share with them, can you remind me to do this coping skill when I'm upset? Because I might not want to do it in that moment, or I might not remember to do it. And then in that case, you might tell them, okay, look out for these signs. Like if I start yelling at everyone, if I start crying, please remind me to do some deep breaths, or please do some deep breaths with me, so that you have some support in that sense as well. So that's something that I would definitely say with trauma, it's very common for those feelings to come up outside of session. And like you said, a week is a long period of time after you talk about something like that, and then you go a whole week before you see your therapist again. And you have to, that's why it's so important that we say when you go to therapy, it's not just talking, you have to build the tools as well. Because I tell all of my clients, if you're coming to see me once a week, that's 1 hour out of over, like how many hours is that? Almost like 200 hours in a week, right? And you're coming to see me for 1 hour, and that's not a long period of time. So if you talk to me for that 1 hour and then you go out of therapy and you just, you don't do anything outside of our session and you just keep doing everything the same, then not much is gonna change, because all you did was come in and complain, and then you left and you didn't work on anything outside of the session. So that's where I always tell my clients, they're obviously welcome to vent and complain and share their feelings, but also we're gonna work on, okay, how can we develop a tool so that next time this happens, we have something that can help you feel better. So that's where, that would be my response and how I work with clients, but I know that every therapist has a different approach with that. Yeah, and Sheeba wants to add something as well.
Also like physically, sometimes people get hurt, right? And between the treatment and the physical therapy part, the doctor will give them restrictions. Don't lift, don't do this, don't do that, right?
Yeah, that's what I'm saying.
Yeah, same thing with mental health. Don't engage in this, don't engage in that, avoid this, avoid that. right? Because you're doing it for your physical health, for your shoulder. Same thing for your mind. They have to be willing to say, I'm not going to do this. Between now and the next visit, I can't do this. The doctor told me not to. I cannot do it. So you have to proactively know your do's and don'ts while you're in treatment. So it's a process. And again, I see the physical aspect of it. We see it, right? Where the doctor will say, okay, no physical activity at school for kids, right? Or you can't go to school for 3 weeks or whatever. Is it inconvenient and uncomfortable for kids at that time? Yes, it is. But they have to heal. So same thing in therapy. As a therapist, we expect that they walk out and they say, okay, I can't do this week, and I can't do that week until I go see them again. And those boundaries have to be firm. Those instructions have to be firm, and then it's up to the patient whether they're going to take that advice or not.
One comment, you said you can share with the people, but with my best friend, for example, maybe she has her own problems and she's depressed already. I'm not gonna depress her more.
So that's a very, very good point that you brought up, is that how do you share with your friends, and not everyone is equipped to take in all that information and keep it private and to keep it confidential. Not everybody has the ability to hear all that. In fact, sometimes somebody will hear somebody's story and react in a way that they don't need that reaction, right? So like I said, it's a private, personal matter. And so when you start sharing with your stories with people in the moment, you may feel that release, but you don't know if that person can handle all that information.
You give negative energy to the other person.
Right, and then it's not fair to them to contain, like I'm a psychiatrist, for example, and I have 3 sisters, and they call me with their drama all day long, and I'm like, I'm not on call, please, give me a break. But what I'm saying, like, you gotta know who to talk to, and that's why, honestly, that's why we're here, so that you know that you do have the resources available, so that you can talk to someone in privacy. You can talk to someone who's a professional, who has the ability to listen and contain that information and help you restructure.
So she's asking in reference to when I said to use the tools.
Oh, to use the tools. So having a support system is different.
Yeah.
Having a support system, and we're like, people are being supportive. Okay, you're gonna go for a run. Great, we're gonna be your cheerleader. Versus, oh, so what did the therapist tell you? Oh, are you doing this because you have this trauma, right? So there's a difference between a support system and then giving your information to other people. So if you have a family member that's going through treatment for mental health and you know that, be sensitive to them too, right? Like, not just dig in, oh, I don't know what your therapy is doing for you if you're behaving this way, right? Like, we hear things like that from people, and then the person goes into shame and guilt, and it becomes worse. So having a supportive environment means that, the family will support you through your healing process, right? So there's a difference between like having friends to tell all your story to and you don't want to give negative information versus having a supportive environment. And again, that's the hard part for people. Not everybody has a supportive environment. Not everybody has those people around them that get it, And sometimes people do go into deeper shame and guilt because of their environment, right? And that's why they have to say, this is my time for my personal healing, whether it's on the prayer mat, whether it's in meditation, whether it's in therapy, whether it's in exercise. You have to give yourself self-care. Like, self-care is key, We're doing community care because we're doing self-care first. Like, first we do self-care, we treat our patients, and then outside of that, altruism, doing good things for other people, makes people feel good. This is our defense mechanism. This is our release. People ask me all the time, as a psychiatrist, how do you hear people's problems all day? And I'm like, I'm not really hearing people's problems. I'm trying to treat their symptoms that they're having, but I have to have my own outlets too. And sometimes I use creativity, I use my social circle, I use community service. So these are important practices to apply in your daily life. And again, unfortunately, culturally, that's not always easily accessible to us. I hope that answers your question.
Yeah.
But it's a very important thing, because you're right. Sometimes you get off the phone with someone and you're drained and you're exhausted and you're like, oh my God, and like, sometimes for me, for example, like after work, I'm not able to talk to anybody. I'm just like, I can't
And
anymore.
sometimes you face the same trauma that the person is healing.
Because please do.
Yeah, so to what you were asking, so about if you need the tools, right? You were saying turning to someone for support, and you might turn to them and they might be going through their own thing, right? So when I was answering your question, what I was referencing in that was the trauma processing. You should not be doing that with your friends or family to begin with, right? So if you're turning someone for support, you're not turning for that. You're turning for, I need a coping skill, I need something to help me calm down. Not, well, this is what happened, this is what I'm talking about in therapy, right? So that should be done in therapy. That should not be done with your family or with friends, because those people are not equipped to process that, right? And even, in therapy, for example, not every therapist is equipped for that because it's a specialty, right? So in terms of that, you would not be going into detail with, the trauma with friends or anything. It's more so what I tell my clients is if you are having symptoms that are like you're having a panic attack, or, you're crying a lot, or having a lot of emotions come up, like you said, lashing out, getting angry at your family members, those are signs that people should look out for. The person that, if you have a few people in mind that you would talk to and tell them, these are the signs that I am, getting triggered right now, and I might need you to remind me to do my coping skills. Okay, so then I have my clients pretty much list out what are the signs that they might be about to be triggered, or might, have a lot of feelings come up that are negative. Write those down, and then next write down what coping skills they're willing to do in that moment. So that could be deep breathing, that could be like the ice. A lot of the kids, they like the ice one. And so it could be that, it could be going outside and play basketball until like I feel a little bit better, going for a walk. It could be anything that you can do that you enjoy, or anything that will regulate your body, right? So in those instances, you're not going and talking to someone like in your personal life about your trauma. You're just trying to regulate yourself. And that person that you have in mind, who's your support system, they're going to remind you, hey, so we talked about this, it seems like you're showing the symptoms that we talked about, and so why don't we try one of those coping skills? Like, do you want to do it alone? Do you want me to join you? We can do it together. And you don't talk about the trauma in that moment, right? Because
Yoga, for example,
yes, it's just support, right? You're being there for them and you're distracting them. Yes, and so you're not digging into, okay, well, why are you crying? Why are you feeling this way? Because then again, that's the processing part, and that the more that you ask them that outside of therapy, that shouldn't be done, right? Because you're opening up things that it's going to make it bigger outside of a safe environment where a therapist is going to be, able to process that with them. But outside of the session, that's not a good idea.
And trauma is very complicated, okay? And there's PTSD that can be, a result of trauma, obviously, where people have flashbacks and nightmares. It's complex. But one thing that people can do, or I'm sure Zaneb uses this technique, and I always tell people, what happened to you when you were 10 was what happened to you when you were 10. So forgive yourself, or start to tell that 10-year-old that you're okay and you survived, and start the healing of that 10-year-old. Okay, and so you have to separate yourself from that 10-year-old, because that person may be 25 now. So they technically physically survived that trauma, and they went from 10 to 25. So they can tell that 10-year-old, you'll be okay. You'll be okay, you're gonna heal, you'll be okay. And so that's the thing I want to share with everyone. Sometimes we internalize things and we hold on to them. And negative things are very easy to internalize, and we say, well, this person said this to me in 1999 and I'm never gonna forget it.
Some people really, they don't forget.
They don't. But again, the mantra's gotta be let it go. That doesn't define you, right? What your 10-year-old self was is not who you are today, right? So what I was, when I was 21, I'm not anymore. So you evolve from that process, and you have to mentally tell yourself that it's okay. Tell that 10-year-old that 10-year-old will be okay. They will survive, So because now you're a different person. You have evolved now from 10 to whatever stage you're at. So we have to learn not to internalize, and I tell this to my patients, set mental boundaries for yourself. Don't internalize everything and make it your own. Separate yourself. Yes, you've gone through a lot, but now you've moved on from all that too, So try to, move forward. And again, the skill set should be healing. We're in the process of healing. We're in the process of moving forward. And again, family members and everyone should just support the healing process. That doesn't mean that, we give each other negativity and guilt or hear each other too, but just support the healing process. And again, trauma is something we can talk about later because, again, of course, I treat PTSD and flashbacks, nightmares. Those are ongoing symptoms of trauma that happen, and that can require different forms of treatment in addition to therapy. So again, we could do a separate talk, but I hope that helps.
Yeah, yeah. Thank you. Thank you so much.
Okay, does anyone have any other questions for us?
I mean,
Sure.
no, you go ahead. That's fine.
So something that both of you had mentioned some examples about how like bullying takes place in our community a lot, and I'm saying mainly. So what is a technique and I feel like as women personally, like I feel like we deal with this way more than men.
Oh,
Seriously.
definitely.
Because we go to an event and I'm talking about it with my husband later, we had a very different experience than I did, So what is something as women that we can reframe, like we've been using this word a lot, how can we reframe how we want to help each other? Like my sister, her shoulders are showing because her shawl, fell off her. How can I help her and guide her in a way that's not belittling or bullying or making her feel bad? Because she is trying, she's here at the masjid, and we want to support that. So how can I be better towards my sisters?
That's a really good question. I think Sheeba wants to answer this one.
It's a great question. It's a golden question. Her and I have been working on that for a while now because we do go through it. You're right. Women and men experience things differently. My husband will also say, "What is like really seriously? Did somebody really say that to you?" And I'm like, "Yeah, they did." Men don't always deal with it. And I learned that like after getting married because I don't have any brothers. That really men and women are treated very differently in our community in particular. And I'm sorry your sister went through that. I'm sorry Zaneb went through that. I'm sorry I went through that. I'm sure many others have gone through that. But we have to tell ourselves, why are we here? Like, why did we come here? That person is projecting their insecurities on you, right? Like their job to come and pray is different from let me critique everybody here and make them feel bad about themselves. So that person's projecting their negativity onto you. And my advice is do not internalize it. So look, you went through something, or your sister went through something, but you showed up, and we showed up, and we all showed up, and so we're still bringing and building each other up, right? So that's the key, and so you're already dealing with it in a healthy way. Is it going to feel bad in the moment? Yes, it is, because we're all human, and so we are allowed to feel bad, and so sometimes we have to admit to ourselves that that felt bad. Like when the lady said to me, I didn't hear. First I was in denial, literally. I was like, oh, whatever, it doesn't bother me. But guess what? I'm still talking about it today. So clearly it did bother me. But what did I do about it? Did I go home and never come out and talk in public again? No, here I am again. Because we have to be resilient. There are going to be people who are going to try to stifle our growth, but we have to get back up. And so do not internalize the negativity, and in fact, hold on to the positivity. And believe it or not, like I know it's hard to believe that, in the battle of positivity and negativity, positivity will prevail. There are some phenomenal people in this community, in this room. They will be your cheerleaders, like they will. And so look for them. And then radiate that positivity and attract that positivity. And there's people like that everywhere. We all do. I mean, I dealt with it in my residency. I dealt with it when I was a student. I dealt with it as an adult. It always happens, and you're right, as women we deal with it a lot more. But that's why we gotta stick together. We have to have the girl power. We really do, and thankfully, like everyone here has that. I think you're doing the best thing by sharing that story. And we all share it, debrief about it together, and we cope with it together. So when she had told me the story, I was like, oh boy, this is familiar, and I was like, well, let's still be a part of the community, still show up for the community, and not let that bully scare us out of doing something good.
Thank you for the answer. I have a question for you. So when you asked that regarding reframing, can you repeat like what you?
So for example, like I'm just making up a story, right? Like
Yeah.
I see somebody and she's going to pray and her whatever is shown. Okay? And me being me, like I want to help her. I want to be like, hey, your hair's showing, you should cover that.
Okay.
But right, like that might make her feel bad.
Right.
Because she showed up and she's
Right.
trying.
Right.
So how can I be a better sister to her? How can I help her cover whatever needs to be covered, but also not detract from her efforts?
Okay. So so I think you misheard the
Oh,
question.
I
That's why I
misheard
was
the
asking her
question.
to repeat it.
So again, I think if you do it very respectfully and kindly and phrase your words in a positive way, not to offend the person. Believe it or not, I went to the mosque and a lady sitting next to me, she didn't speak English. She took out nail polish remover and socks and handed it to me, you know, literally. And I just took it and I put it in my purse and I said, thank you, you know, like, I mean, that was it. That was the end of that. But perhaps she meant well. And then there was another lady, when I was completely done with my prayer, she said, you know, I heard that after Jummah, if you pray in a different part of the mosque, you get more reward. I heard, I could be wrong, but I just wanted to share that with you. So the way you speak to people and the way you give that message is very important. So if you deliver that message respectfully and kindly and start it with positivity, you know, I'm so happy to see you at the masjid, sister. It's so awesome. May Allah reward you. May Allah make it easy for you. I just wanted to, you know, share this, you know, once my shawl fell off and somebody told me, you know, make it pleasant and nice and inviting, not so the person has an aversion. So before you speak to that person, again, think, you know, start with salam, you know, give them peace, and then keep it positive. So you can deliver a message, but it's how you deliver that message. And again, there can be very good intention with all those people that have corrected us. There can be very good intention. It's just the way in which you do it, right? So unfortunately, sometimes things can come across as negative criticism. And that's hard to deal with when you're very young, you know? So you want to be very sensitive to that person. And like I said, some lady literally gave me nail polish remover and socks, and I'll never forget her. And I just put it in my purse and I said, thank you, you know? She meant well. She meant well. And so, you know, so there's kind ways of doing this. Does that make sense?
Yes,
Is that a better way of restructuring?
Yes.
Okay. Sorry, I misheard you.
No, I love that, like, starting with the, it's so good to see you.
Yes.
I love that.
Yes, always start with positive words. When you see someone, when you greet someone with a smile, you know, rather than, oh my God, you look so tired, oh, you look so good, oh, it's so good to see you, I'm so happy to see you. Make this a part of your daily conversation. You'll feel better. You're projecting more positivity. So even the message will seem so much more pleasant. They'll never forget it. You know what I mean? I hope
Yeah, and
that-
always treat people the way you want to be treated. You know, like
Yeah.
think about it. If you know, if my shawl did fall off, how would I want somebody to say something to me? You know, that would still make me, you know, want to change my behavior, but still be positive about
Yes,
it. Yeah, I think that's
absolutely.
really important as well. Yeah.
And then try to avoid putting people through feelings of shame, embarrassment,
Yeah.
and guilt. That's the last thing we want to do is shame someone or make them feel guilty or embarrass them. Like, you don't want to be that person who's going to put someone in that state of mind. And we all get affected by things we say to each other. We really do. And we all minimize this in the mental health field, right? Like, it's not so simple. It's very complex. Sometimes people will be really mean and that'll affect how we behave and feel, right? So I always tell people, you be in the driver's seat, control your mood, don't let your mood control you. And then I say, this is all easier said than done. Like, it takes a lot of practice and application, but you stay with the positivity, stay with the built-in system of, you give them peace, say something kind, and then move forward with that. I hope that
Yeah, and Sheeba, also, you can only control yourself. You can't control other people.
Right.
I think that's also something that you really need to, you know,
Yeah, I mean,
make sure that you understand as well, you know?
yeah, it's hard
Controlling
to,
your own actions.
yeah, always look in the mirror.
Yeah.
That's another thing that we were trying to help people understand. Always look in the mirror first. What am I doing? Is this gonna make me feel better at the end of the day?
Right.
Is this gonna be good for me and my soul and my conscience? So how am I doing? Am I being nice to that person? Was I rude to that person and then they reacted to me? I don't know, right? So always look in the mirror first. And that's a really good tool. Awesome. I think there was questions on this side as well? Yes.
Yes. So in the beginning, you said that depression can be genetics too.
Yes.
So are we able to like break that? Because I just had a daughter recently, and I mean I love my mom, and I don't know if she's been diagnosed with depression, but I obviously feel the symptoms in myself sometimes, and I
Right.
don't want to pass it down to my daughter. So
Okay,
I just want to know if like it is genetic, like how do I break the cycle?
Yeah, so it's a very good question. She said if it's something that's genetic and, you know, if your mom has something, how do you break the cycle and how do you not pass it down to your daughter? And I will just say that genetics obviously are something that you are born with, right? And so if high cholesterol runs in the family, you know, at a certain age, you may have high cholesterol and it may be something that runs in the family. But again, I would say always be protective of her mental health and take care of your own mental health, right? And so know that there's a family history, so I have to be especially careful. Like I have hypothyroidism in my family, so I've always looked out for my thyroid because I know my mother has it, my father has it, my sisters have it. So you want to kind of have that self-awareness and make sure that you're on top of your own mental health and your daughter's mental health. But sometimes what happens is the reason we explore that is, you know, at what stage of your life did your mom have it? Was she on medications? Was she not? And sometimes, you know, family members, the genetics will make a difference, and it can guide treatment as well. You know, like sometimes people will say, "Oh, my mom is really good on this medications." Although everybody's different, then we know that okay, genetically this is suitable for you. We can try this medication for you as well if you want. You know, so it's not something that you can necessarily erase, right? Because our genetics are our genetics. We can't change it, but you can have a healthy lifestyle. You can use the, you know, tools that we talked about, the exercise, self-care, mental hygiene, practicing good mental hygiene, take care of your sleep, take care of your appetite, really take care of your mood, you know? And so, and if you, God forbid, start to see that your mood is starting to get low and it's consistently low over a period of weeks, then maybe get help that you need. So genetics does play a role. Unfortunately, we can't erase it, but we can prevent it, right? We can prevent things from happening by taking healthy steps. But there are times where people will do everything right, and they'll say, "Doctor, I do this. My life is great. My life is great, but I still feel this way." And in that case, it's okay. It's okay to get treatment for something. There's no harm in that. I hope that helps, and I hope you and your daughter stay healthy. You know.
Yes. Also, Sister Salma wanted to know if you do appointments, or should I just schedule one for her son?
Okay. For therapy.
Yeah, we're going to talk about, but first of all, thank you very much for you guys doing this for community.
Of course, right.
We need it because the counselor we take from is very shy. People can open up.
Yeah.
You know, it's very important. You can trust somebody, then you can open up. You can prepare to your family and some other friends. You know, is something going on because they can explain themselves. You know?
Absolutely.
And recently, I have a friend of mine, very good friend of mine, who's talking about, give up because she has no place to talk.
Right.
And then was very sad in the community, you know.
Yeah.
So we have to know, recognize this thing because without back home, we don't recognize this symptom. Over here it's easy, you know.
Yeah.
So like you said, like if somebody has it, everybody has it, you know.
Yeah.
Some kind of one way or other.
Yeah.
Like we go to the doctor, we have a blood pressure, we have a this, we have
Right.
one person has so many things because this thing also could be happening because that could be, now we are looking for a bad day, you know. But
Yeah.
we have a different positive, like it's a positive way
Yeah.
to help.
Yes.
You know, somebody like
Yes.
how we can help them.
Absolutely.
So now we can, you are in Muslim community, and yes, we have somebody Muslim community, let's go to help. So
Absolutely.
thank you for that. And
Of course.
question is how we can open up, how we can recognize that somebody has this symptom or they need help. You know?
Okay, yeah, absolutely. So, I mean, in terms of what you're describing, when there's loss or when people are going through the bereavement or they're going through grief and they're mourning, you know, I would say as community members, we have to be supportive. And a lot of times people start to rationalize things and they say, oh, this shouldn't have happened or that wouldn't have happened or if this would have happened, this person would have been alive or not. When you don't know what to say, don't say anything at all. Just say, I'm here for you if you need anything. Just give them the comfort and the support that they need. And unfortunately, a lot of times when people are feeling bad, you don't want to make them feel worse. So be very cautious and gentle with your words and just give them support rather than making an interpretation of the situation, you know? And then when it comes to depression, if people are the symptoms, I'll explain it, you're just feeling low and you don't have any interest in doing anything. And even if you're doing something, you're not enjoying it. You're having crying spells. You're having changes in your appetite. You're having changes in your sleep. You're feeling hopeless. You're feeling helpless. You're feeling guilt. Should I have done this? Should I have not done that? Why did this happen? Feelings of guilt, energy gets really low, inability to concentrate. This is going to happen over weeks on end. And so if you notice someone's not themselves, you see someone regularly at the mosque and they're a happy-go-lucky person, and now all of a sudden they're not themselves, they could use help. And again, I think we keep an open door policy to the community. You know, as I think Zaneb, you have a website and all of that for therapy, etc., to kind of help people understand and recognize. So bereavement and mourning takes time, and again, we're here to help each other heal. We're here to educate people about major depression, about bereavement, about generalized anxiety. These are common things that people are experiencing in our community, but again, we're here to help that. So if someone's really not themselves and you don't see them around, or they're not engaging in activities as usual, there may be something happening. You see them crying frequently. And I would say give them empathy and support. Not a reason this is happening because of this, or because this is happening because of that, or that should happen. Just, you know, and see if you can help them. To say, oh, I know somebody, this might help, and extend the information to them. Also, I just want to bring to everyone's attention, 988 is the National Mental Health Hotline. It's 24/7, it's completely free, anybody can call at any time. I say this at the end of every visit to my patients. If you ever need anything, anyone in case of an emergency, 988 is the National Mental Health Hotline. It's almost like calling 911, but you get a mental health specialist on the phone.
I have a question, sir. If you see someone has this symptom, how do we handle this? And if the person is private, they don't want to disclose, they want to admit if they have something, but the other way you notice something is not right, she's suffering or he's suffering.
Yeah.
In that case, how do you handle this?
Yeah, and that's very challenging because again, in our community, there's denial, right?
Yes.
We don't accept when there's a problem. But if you as a community member are recognizing there's something there, we need help, you know? Like I said, provide that trust within the community and offer the help in a gentle, respectful, mindful, considerate way. Not to make someone feel bad, but just to say, you know what, I heard there's a Muslim therapist here or a Muslim doctor who can help because I've noticed you're not feeling. Again, phrase it gently. God forbid if anybody was talking about wanting to end their life or anyone else and there was a safety concern, again, crisis 911, 988, those are life-threatening situations that we cannot ignore. Like that's the psychiatric emergency. But if you're feeling that someone is really off and they really need help, again, provide the resources. And again, that's why we're here, to provide the resources to people. Again, it's hard to convince people that what you're asking is very hard to answer and it's very hard to do.
Yeah, because if you need to help in that
Yes.
perspective, sometimes people get offended.
Yes.
Wait, I'm psychic
Yes,
speaking,
please
I
do.
have problems, speaking, I have this.
Yes.
Why are you asking me this? Why are you telling me this?
Yeah.
This is the very stressful
Depends how
moment.
close
How
you
do
are to that
handle it?
person as
Yeah,
well.
absolutely.
Being that people in a positive.
Yeah.
Right, so I
What
see
kind of
that.
therapy, what kind of therapy you can use,
Yeah.
technique you can use?
Yeah, so I see that a lot with my clients because I see kids as well. And, you know, a lot of, kids usually aren't choosing to come to
Yes.
therapy, right? So the way that I tell the parents to kind of approach it in that sense is don't blame them, don't make them feel bad or guilty or like something's wrong with them, because like you shared, it's very important to be sensitive. So if you go to someone and you're like, oh, you're acting crazy, you need a therapist, like, you're making them feel worse. They're already feeling a certain type of way, and then you're labeling their emotions in a very negative way. And so I think a lot of people, they are just saying it because that's what they're seeing, and they're thinking like, okay, well, this person's being irrational or whatever the case is. But a lot of times that doesn't help the other person go and seek help. So what I would say is being compassionate and caring, and labeling the symptoms as, I've noticed that like it seems like you're a little bit down lately, and there's some options for support, and I could go with you if you want me to go with you. I could help you schedule an appointment. And a lot of times my clients, like the adult ones, they'll bring their friend or they'll bring someone with them as a support system, and I always allow them to sit in the session, or they can wait in the waiting room, whatever they're comfortable with. And then with the kids, like I said, I always tell the parents, don't make it like that there's something wrong with the kid, and that like you're making them feel bad. Like now they are feeling, I've had kids, they're like, oh, I feel bad that my parents have to bring me here every week, and like something's wrong with me, and I feel like a burden. And that's what wording that you use is so important. And so I speak to the parents about that, and I ask them how they're speaking to their child and what words they're using, and they a lot of times don't even notice that they're doing that. And so that's where educating the community, like the question that you asked was a great question, because it's so important for the community to know how, if they're seeing the signs, how to help someone be open to getting services, because there's so much stigma around it, like we've been talking about, where people in our community, they don't know that much about what the resources are and what signs to look out for. And so that's what I think both of us would say, is just being very sensitive, being supportive and compassionate when you bring it up to someone, especially in terms of like, you know, grief. If someone just like lost someone, if something happened to them, you know, it's
normal.
It's
normal to feel sad
It's normal.
and to mourn the loss of someone. So there's a normal response where people are allowed to be sad, you know, and there's a difference between mourning and being sad about something appropriate, or it being a depressive disorder, right? So there's a time frame, you know, like if you see that, okay, now it's been, you know, an extended period of time, this person is still not functioning right, then that's maybe when they need help. But initial stages, when someone has grief or loss or trauma, it's okay to cry, it's okay to be sad, it's okay to isolate yourself for a little bit, you know, but it depends now, is it affecting your work, is it affecting your family life, is it affecting your daily life now? But initial stages of grief, sometimes you have to let people mourn whatever it is that happened, let them process it, and then slowly kind of come out of it and give them the compassion and the time that they need to heal. You know, so a lot of times when people come in to see me after a loss, I tell them it's okay to cry. It's okay to be sad, that's totally normal. If you weren't crying, I would be surprised, you know, because that's a normal response to grief. So sometimes it's okay to embrace your feelings and just be compassionate. But if you see that this is really affecting this person's ability to function, and now it's been a really extended period of time, then very sensitively, respectfully, compassionately, empathetically, you know, we can try to help them get help. But again, it's important to be able to embrace our feelings. Not everybody can feel good all the time. Not everybody can feel happy all the time. Sometimes there's appropriate responses to things, right? Like if something bad happens, it's appropriate to cry. If something good happens and we see something pleasant, it's good to laugh and be happy. So there's an appropriate response, and then there's a prolonged and inappropriate response where someone may need intervention. I hope that helps. Anything else? Anyone? Yeah.
I know your job is dealing with the people with a lot of problems, and then how do you handle the outcome? I know you as a doctor and as a therapist is going to learn about this a lot and you will find a lot. And then how do you handle the problem here? You know, at
How
the
do we
end of
handle it?
At
We
the end of the
debrief.
day, this is
Yeah.
your
Yeah, we have a lot of, we have to have a lot of creative outlets.
yeah,
We
you
have,
go through the
Yeah.
practice or through the
For us, is
Yeah.
that what you're asking?
also a lot of therapists have therapists, a lot of psychiatrists have therapists, and that's completely, yeah, absolutely. And just give my piece and then you tell her. I think it's really important for us as mental health providers or psychiatrists, therapists, psychologists to take care of our mental health. And so sometimes we can get burnt out and we start to feel it, oh my God, I'm getting burnt out, there's too much information. So we also have to reset. We also have to do things to take care of our own mental hygiene. We also have to be cognizant to surround ourselves with good people and you know, so it's not easy, it's not an easy job, but again, the thing is we try not to internalize things. Our job in the moment is to help that person with what they're experiencing, and at the end of the day, that can be a lot. But again, we have to create the creative outlets and other, you know, healthy avenues to make sure we cope with that. And of course, there's nothing wrong with having your own therapist. Most psychiatrists and therapists do have their own therapist where they can debrief and kind of unload. So this, and again, we can all say that there's no harm in that. You know, that's a very healthy way to manage things. And again, surround yourself by good people. Take good care of yourself. Be your own best friend. You know, that kind of thing. So yeah, it's not easy, but you know, nothing is easy, right? Like we all have to take care of our mental hygiene. We really do. And so I think for myself, I've tried to surround myself with very positive people. Thank God. We try to do a lot of positive things within ourselves, as a community, as friends, you know. And when there's too much negativity, step away. Don't internalize it and step away and move forward. Let things go. So that's what I try to do, at least, you know. So then if you share what you do.
Yeah, So I agree with pretty much everything Sheeba shared, but I also want to add that for me, every coping skill that I teach my clients, I use all of them myself. And so Sheeba mentioned earlier, like the deep breathing, and I use that every single day. I use it throughout my day, every single day. And on top of that, the ice and, you know, all the other techniques, and those are the ones we mentioned today, but all the other techniques like exercise, you know, nutrition, boundaries, like what you were saying, making sure you're not being around too much negativity, because we are dealing with other people's emotions all the time for most of our day, right? And so I think that's something where, you know, it's really important that we use the tools that we're teaching our clients, because we're human beings too. And a lot of times, again, I see kids, and so the kids, like when they're seeing me, they see me being very happy. I'm playing with them. We go outside a lot during our sessions. We do artwork, and so when they see me, I'm very happy. I'm usually a bubbly person, and a lot of them come in and they have a mixed range of emotions and feelings, and they'll tell me, well, you've never been angry. You don't know what being angry is like. I'm like, I get angry all the time. I'm a human being too. And they're like, well, you don't seem like it. And I'm like, when I get angry, I use my tools. Right now, I'm not angry because I'm having fun. You know, we're talking, we're playing a game, whatever the case is, and I'm at work, right? And so normalizing the feelings and that, you know, for the kids as well, helping them see like feeling a negative emotion is not like not normal. Everyone feels negative emotions, even therapists, because we're human beings, and in our field as a psychiatrist too, Sheeba feels negative emotions too, we all do. But it's having the it's having the tools for it. And so that's where, again, we practice, or we try to practice the things that we teach our clients as well. And if we didn't practice them, then it would be very hard to do our job.
Thank you. I just want to add, prayers make me feel good. Like there's a time in my day or in my week where I can just pray, as we say, Allah subhanahu wa ta'ala is all hearing, right? So He's hearing us all the time. And I just kind of pray it out. That's a huge release for me, because I trust Him and I know He's not going to tell anyone, right? So that's like all hearing, you're going to pray. And I think I've had a toothache, for example, and we're human, and so sometimes that affects how am I speaking to people, because I can't speak a lot, or my mouth is full, or whatever. So everyone's going through something, you know, and so we all kind of have to give each other that grace that this person's going through something, or maybe I'm going to talk less this day because of this situation or that situation. So, you know, sometimes people are doing certain things because they're in pain, or sometimes people are behaving a certain way because they're going through something. So we just kind of try to be mindful of those things, but we try to use the coping skills, and it really is encouraging to see all of you here and to interact with us and to engage in this conversation. And I really respect and appreciate each and every one of you for being here. And I hope we can continue the conversation and we can continue to help you all, inshallah. May Allah thank you.
Thank you.
Thank you.
I also want to add thank you everyone for coming today, and may Allah reward everyone and us as well for being here. And inshallah, there will be many more talks like this in the community, and that's our goal here, is really just to help the community be more open and talk about these topics that we have not been talking about. And I think it's time for a change. So inshallah, there will be many more like this. Thank you everyone.